Good day, Ergo-flex family. Dr. Robbie Wyatt, Chief Clinical Officer for Ergo-flex Technologies, home of the Back on Track, Knee on Track, and the Total Brain and Body O2. And I want to talk to you about the Total Brain and Body O2 today and just how effective it is at helping your patients beat hypoxic hypoxemia. And it basically means your patients are not perfusing their tissues correctly. And a big factor of this is being able to actually increase the body's ability to output hemoglobin, which basically means red blood cells. And to do that, you have to put them in a stress state. So, look, there's two modes that you can train in with exercise with oxygen. So we can go performance, all right? VO2 max, target heart rate, and just blowing people out, sweat pouring down, and then when they get kicked into depleted oxygen, they have a huge parasympathetic response. All right, that is very effective as far as being able to effectively bring that individual back into a state where they are oxygenating at a much higher rate, VO2 max, and looking performance. Now, the most people that we deal with and patients, we're not dealing with performance enhancement. We're dealing with working with improving their overall health. So I propose that we take a look at how to use, in a non-performance state, exercise with oxygen therapy. So on the Total Brain and Body O2, we have control mode. Control mode basically looks at how the body it works off a heart rate. So it's target heart rate, it's specific, it's using your age and those numbers that we all know. So my target heart rate should be about 125, and then to recover, my heart rate should be down around 78. Well, I'm a deconditioned individual. Okay, I'm getting conditioned, but right now, when it comes to heart and aerobic activities, I'm pretty deconditioned. And that means that my heart rate is typically up in the 80s, and it is extremely difficult for me to get my heart rate above 120. And when we base a program, a software package, on heart rate, unless you have a highly conditioned individual, you don't have hardly any predictability as to how to get that patient where you want them to be. Okay? So now in steady state, second control mode for the total brain and body, it starts you in depleted. Okay? You start in depleted oxygen. And I can set the patient up for whatever amount of time I want them to be on it. All right. I recommend a minimum of 3 minutes, 180 seconds while in depleted. And the reason why I say that is because the literature is pretty clear that it takes about 2 minutes or a little bit more for your body to use up its oxygen reserves. So everything that's in the tissues being stored in the bloodstream, attached to hemoglobin, attached in other cells, it takes about 2 minutes for your body to really go through that oxygen, okay, and burn it out. Then what begins to happen when you're at 12% oxygen, which means you're probably about 15,000, well, you are 15,000 feet, that's basically base camp for Mount Everest. Your body starts to lose its ability to perfuse tissues at 100% or above 96, 97%. So when you look at SpO2, that's the perfusion rate in the capillary bed in your extremity. That's what SpO2 is, okay? So anything above 95% is pretty darn okay. All right? It's not horrible, not great, but it's not horrible, all right? If we get below 90% and people are staying there for extended periods of time, they're not in good shape. Okay, from 90 to 95, those people are not as efficient as they should be, and something needs to be addressed. And we see this all the time in neuropathy patients. So I'm looking at index, second toe. I'm looking at those capillary beds before I start them in their total brain and body O2 session, and after. I want to see how well they're perfusing both before and after. I'm looking at blood pressure on both arms and capturing that data as well. Entering it in the total brain and body O2 software so we can track visit to visit, pre and post. All right. Key critical component. So I've been using a power plate or a vibe plate, whole body vibration, true vibration, not oscillation, and doing mild to moderate exercise while the patient starts in a depleted oxygen state. So that 2 minutes goes by, they burn up pretty much all of their reserves of oxygen. Now, the more aerobically fit your patient is, the faster they'll do this, all right? So after 2 minutes, you start to see them really drop their SpO2, their partial pressure of oxygen in the capillary beds, significantly. So they'll start hovering around, they'll be in the 93s, 92s, 90, even 91. Those who are really efficient will get into the high 80s, so 85 to 89. I've got a doc that has a total brain and body O2, and I've seen him go to 80% and stay there, okay, very quickly. We don't want them to be below 80% perfusion rate for more than 15, 20 seconds, that they will pass out. At worst, they will have they will have a seizure at that low of under mild to moderate exercise. So you definitely don't want. If they get down that low, you got to kick them back up. Now, the whole time, total brain and body O2 is monitoring heart rate, respiration, SpO2, so perfusion rate, and time. So time's a big factor, right? So 2 minutes in, that's when you really start to pay attention to what's happening with their SpO2. And typically what happens is they float at 1 or 2% up and down as to where they're going to be the lowest. So from 120 seconds to 180 seconds is typically when they kind of get to their lowest point. And then when we hit the 3 minute mark, 180 seconds, it kicks into concentrated oxygen. Now, most individuals will have a complete recovery. So let's say the individual is at 89% when they switch into concentrated oxygen. Now, typically 45 seconds later, they'll be at 98, 99, or even 100% perfusion. All right, 98% is typically what I call full recovery in the perfusion mode. All right, so they get back to 98%. I pay attention to how long it takes them to do that. The first 2 or 3 sessions is usually 45 seconds to a minute. I have seen patients take over a minute, significantly over a minute 20 seconds to fully recover. Text and the research says everybody should be at perfusion of 98% or higher within 45 seconds. That's how efficient our pulmonary system is. Now, if you've got COPD, you got some other disease process of the lungs, that's not going to happen. All right, it's going to take much more time for them. So now, that is a key indicator as to how well your patient is perfusing. All right. Now, they stay in that high concentrated oxygen for 2 minutes. All right. It takes them 45, 60 seconds to recover completely. And then I want to give them a good 60 seconds, sometimes more, depends on how they're doing, of concentrated oxygen. Past that, they really don't need it. And here's why. Because when they're in the depleted oxygen state and they are at their lowest SpO2 perfusion rate, and they've been in that for more than 45 seconds, the literature says the kidneys kick out EPO, erythropoietin, all right, which is a key signaling event for the spleen to excrete the red blood cells that it's been holding. So we suddenly increase the body's ability to actually move oxygen because it's in a depleted oxygen state. Perfusion is down and the body's looking away to actually get more oxygen to the tissues. So that's a key factor. So we put the body into a fight or flight sympathetic mode, and suddenly we increase its ability to put out hemoglobin through red blood cells. So we're increasing their capacity. Now we're going to keep them we're going to shift them into concentrated oxygen and allow them to perfuse at a very high rate. All right. So when they're in that high oxygen state, 80% is 395 millimeters of mercury as they breathe it in. All right. So there's about a 35% loss because of CO2 solubility, 20 times more soluble than O2. And so by the time it gets into the alveoli, we're dealing with somewhere around 250 plus millimeters of mercury, partial pressure of O2 in the alveoli. Normally it's 104. Okay, so we are 100% higher partial pressure of oxygen in the alveoli and concentrated state on total brain and body O2. Okay, normal returning arterial blood flow from the lungs is 40 millimeters of mercury. So now, instead of 104 millimeters of mercury and that pressure change occurring, now we're at 250 plus millimeters of mercury. So the body's ability to actually perfuse oxygen, respirate oxygen into the bloodstream is dependent on how much red blood cell and how much hemoglobin we can get in there. That's why it's important for your patients to be exercising mild to moderately in a depleted oxygen state, and then they get switched into a concentrated oxygen state. I say this because I understand that most of the doctors using these systems, whether it's total brain and body O2 or another, is that they just have them breathe in concentrated oxygen. Well, that's an inverse relationship to hemoglobin. If they're just breathing in concentrated oxygen for 10 to 15 minutes, it's telling their body that they don't need as much red blood cells and hemoglobin to transport to perfuse. So that's making them dependent on concentrated oxygen. This is exactly what happens with patients who go on cannulated oxygen that's prescribed by the medical doctors. They get off of it, they get more. So it's critical. It is critical that we put our patients in a sympathetic state, stress them, have their body actually expel more red blood cells so that they have a greater carrying capacity for the O2. So that when we take them out of the depleted and into concentrated oxygen, now they get much higher absorption rate, which means perfusion rate. And it stays that way. Okay, it stays that way over the next 3 days before they actually recycle this red blood cells again. Critical, critical, critical. And guess what? It's a 5-minute protocol. 5 minutes. All right, 2 to 3 times a week. Perfect for your neuropathy patients, or you fill in the blank, because hypoxemia is the beginning of just about every disease process known in the human body. Okay, so very simple. I prefer the Vibrate. You can do it on a recumbent bike, you can do a sit-up bike. I like the Vibrate because of the neurological reset it has for the Golgi tendon, muscle tendon. If they just do a little small squat or they walk in place or anything like that, they are activating upwards of 98% of the muscle mass in those musculoskeletal muscles, and it's firing off all of the mechanoreceptors in the entire spine. So if they got a bad knee and they really can't do much, they can stand on the biplate and do small squats, or they can walk back and forth. I'm telling you, it's mild to moderate exercise. They do not have to get a big bad sweat on in order for this to happen. All right. I'm going to be talking more about this at our Secrets to $1 Million Practice. I'm going in depth into how this mechanism actually works, much more in depth than we just talked about, so that you can get your neuropathy patients and every other patient that you have in your clinic better, much easier, and a much deeper effect. And you can cycle multiple patients. I'm just restricted to a 15-minute treatment cycle here. We're talking 5 to 7 minutes. 7 minutes is when they actually get 4 or 5 visits in. They need longer in the actually depleted state. I did 5 minutes in depleted state, got my SpO2 down to 85, heart rate up to about 110, just by walking on the biplate in depleted oxygen. Okay, it really stresses your system. So come find out more about that at Secrets to $1 Million Practice. And I just talked to JT, and he wants us to do an Ergo-flex Academy on Thursday afternoon. You come in Thursday morning, come in 4 hours in the afternoon. We are going to we're going to do a workshop on the specifics of all of our equipment. Back on track, knee on track, total brain and body O2. You'll get one-on-one time with me, as much as you need as I can, depending on how many doctors we have here. If you have staff, we can train staff. Brand new, not kidding you, 2.5 hours ago we talked about it and decided to implement for this Secrets. Again, this Ergo-flex Academy will get you credentialed and certified on all the equipment you have in your office, and you can get more in-depth knowledge and specifics about what the total brain and body O2 does and why you need it in your office. And if you already have it in your office, I'm going to quadruple your ability, quadruple your ability to put patients on it and keep them from having to just have a sweat fest, because we don't have to be using that performance mode, which is the control mode. All right, guys, keep saving lives, and we'll see you at Secrets to $1 Million Practice, March 22nd, 23rd. Get your tickets. Seating is limited, and they're flying out the door. Early bird special is just about to end.